I can't see it.
Hi everyone and very good evening to all of you. I hope that we are audible. Please give a reception if it's audible to you all of you guys.
Yeah, I think we are live, I guess.
Yeah. Good evening, everyone. I hope the audio and video is fine. Can you please give a quick thumbs up to check whether it is clearly visible, the audio and video is fine.
I
think it's a stop.
Yes, it is not there.
No, it is there. Yeah. Okay. Hi, Rohan. Hi, Anita. How are you? Okay. All right. So welcome to this session of last minute revision strategy for the INI-CET exam. Now the exam season has come, and I'm sure that all those who have started at the time, you are already towards the end of your revision or towards the end of completing your course. Some of you have completed it and some of you have not completed it. A big exam is coming in the second month of November, INI-CET exam, and another very, very big exam is coming in the March, for which we all are waiting. So this session is specifically planned for the students who are targeting INI-CET with the full strength. And with me today, I have Dr. Praveen and Dr. Sushil, and we will try to tell you that what is the best way so that you can utilize your days, which are the upcoming days. Over to you, Dr. Sushil.
Yeah. So thank you so much, sir. So hi, good evening, everyone. And actually, I'm unable to see the session, sir. I hope you are seeing that we are live and it's all going good. So first of all, now the time is not much, almost less than a month, I must say. And the first thing that I would just recommend is that do not get carried away by any of the messages that you are getting from anybody, that I have read this much and this was something very important that you have actually left. Have trust on your preparation, that whatever you have done till now is actually the best one, right? And you are the best judge for yourself. If you know that you have done the best part, then just trust on that. Don't get carried away by any other kind of news, any other kind of message that this was a point which I missed, some other, my colleague is doing some other book and some other notes, I should also go for that. No, just trust on your preparation. Whatever notes you have read, whatever content that you have read, whatever MCQs that you have solved is actually the best one. Have trust on that, first of all. Second thing is, this is the right time, and the time is not, has actually been passed away, where you should be able to, and you should actually be ready to just, believe whatever you have read is good. That is one part. But second is, wherever you are not good, that also you should learn. That if I'm not doing something very good in a particular subject X, my SWT of that subject S is not very good, the scores are not very nice, I am not able to get the concept of that subject or any of the fact of that subject. So this is actually, you are having a lot of time to just resolve that issue as well. Just, doubt yourself for that thing. Accept that point, that I am weak in this area. And if you are, courageous enough to accept that point, this particular subject is not good, this particular section of the subject is not good, that should be going very, very fantastically. So just improvise that point. That is another thing I wanted to convey to you.
Yeah.
Third, I would just say that, one best idea that you all might be doing all the time, whatever subjects you have done till now, and if there is some major issue, major subject which is left, what I would personally believe is, you must now go on with the previous year papers or the topics of that particular subject. Don't try to just run away with the content part and you are not very clear with the basics and all. That's also not a good idea. Whatever you have done should be very strong, and you should be, confident enough to answer everything from that particular section. If you just keep on lingering onto the things that I will just complete all the 19 anyhow by hook or by crook, that's not going to work. So anything that you have learned, confidently, just improvise that part. So that is what I wanted to convey to all of you. I think I can just pass it over to Praveen sir. He's also there with us. Praveen sir, over to you.
Yeah, hi, thank you, sir, and I welcome all my students who have joined us.
Praveen sir is looking dashing as always.
He's getting
fresh after
day
taking
by day.
such a big class, unlike us.
I think the energy comes from you also, and I believe that we can start with the strategy videos to start with. I'll come back to me myself.
Yeah. So basically, see guys, I will say that all of the exams, that the easiest exam to predict is INI-CET. Previously we all know that the multiple exams, AIMS, PGI, JIPMER, NIMHANS, and now they all have been clubbed into the Institute of National Importance Common Entrance Test, which is called as INI-CET. But one thing that I want everybody, because there has been a lot of rumors that keeps on going, that the responsibility of the conducting this exam lies with AIMS New Delhi. So these are the simple strategy that your preparation should be directed toward what AIMS ask. So for me, it is AIMS. It is not INI-CET. It's an AIMS exam. And that is why in our classes also a lot of time I say that this question is asked in last year AIMS, and people are thinking what is AIMS. So I say AIMS is same as INI-CET. The single most important strategy that anybody will ask me is, I will say that you have to be very, very thorough with the last 4-year AIMS paper. And when I say very, very thorough, that means whatever choices that are being asked, whatever topic that is being asked, whatever is the answer of the question from the previous year has to be very, very thorough. This is the single most important strategy, and then period. That's all. If you want to crack the AIMS exam or the INI-CET exam, even if in your sleep, somebody asks you a choice, somebody asks you that pick up a choice, you have to know that. If you can do that, you are good to go. That's all. That is the only point that is from my side. Over to you, Dr. Praveen.
So, sir, I have prepared a small checklist that students should do. If you allow, we can just share that.
Please go ahead.
So, Ritika, I would request you to please allow me to share my screen or from the iPad.
Ritika, are you here?
So, already given access.
Okay. So I think the screen is visible. Maybe we should first of all make a checklist of what all must be done to crack the exam. So these are checklists that will help you to make sure that you are not missing on the important points. I believe that as Dr. Sushil said and Dr. Rajat told us, that the previous year questions right from the 2018, 19, 20, 21, 22, these are must to do. It is very, commonly said that 80-20 rule, right? So that means that those 80 questions, 80% of the questions actually come from the 20% of the topics. So when we say 20% topics, what does that mean? This previous year question talks about those 20% of the topics from which 80% questions are based on. So you can actually predict your questions of the main exam by just looking at these basic things. Okay, so don't miss on these things. If you look at the second point, INI-CET or AIMS as such has been very much keen upon asking you instruments, then very keen about asking those procedures. And these processes are not out of the blue. Something which you have learned in your internship days, something which you have done this very keenly in your post-internship days in your regular hospitals, or something which you read on daily in your usual classes also. Those are the usual procedures. That means if you ask me, sir, what are the basic procedures? I would say examination of breast, examination of thyroid. In the orthopedics, the basic tests, as Dr. Sushil will also talk about, they keep on asking you how to test for the lemniscus or how to test for the anterior cruciate ligament or the posterior cruciate ligament injury. Those tests are always a frequently asked question in the INI-CET exam. So I would surely ask you to read all those instruments which are usually asked. not to miss on any procedures. That is also very important point here. ECG, we do expect a question on ECG, but I don't think you should go into depth of ECG. I believe that the most frequently checked ECG could be surely be asked there. And same goes with the acid-base balance also. The practical aspect of everything is very important. INI-CET also AIMS exams are very practically oriented exams. They have some clinical set of thought process, and that actually comes from, again, these 5 years questions only. There's nothing new that can actually add up here. So be ensure that you know about the clinical examination as for the breast, thyroid, and not to forget about the trauma. Okay, that's again is very, very important here. From the medicine point of view, I will surely ask you to not to miss on the neurology part. And a very famous book for dermatology, you all know, is Nina Khanna. Look at those images. Don't miss on that. This is very, very important. Similarly, psychiatry is a bit important. I'll not look into all of the other subjects which you have not covered till now, to look into covering all of those. But if you ask me personally, what I believe is that the INI-CET is good amount of loaded questions come from the first and second prof exam questions also. Not to forget the dissection videos, which was very, very when first time it came. And it actually shook all the entire community of medical fraternity as asking the dissection videos that should we go back and go to read those first year dissection videos. Thankfully, Dr. Ashwini came up with a noble idea of making all those videos, and it actually become an instant hit. In the PSM, I would again ask you to write mainly focus on biostats and epidemiology basically, and not to go on to read every other stuff that you actually can. To add to these, ensure that in the last 7 days, you need to revise the IPCs, you need to revise the staging system, and the cycles of biochemistry, which is very, very volatile. Try to also go through that. New drugs, which you have read in pharmacology, must be your go-to the topics in the last 7 days. So, Dr. Sushil and Dr. Rajat, I think that these are what the students should go into the clinic, their checklist actually, which they should not miss into.
I mean, very, very nicely summed up, Dr. Praveen. One thing that I just add, another topic that I can feel that the student can pay attention to is a pediatric surgery. Pediatric surgery is usually, Dr. Praveen, you have to just change your iPad. I think it is still.
Sir, I've just removed it just to talk now.
Okay. Yeah. So is pediatric surgery. AIMS people are very, very fond of asking questions from the pediatric surgery, specifically the childhood surgical disorders, and just make sure that you're very, very thorough with them. A lot of people have this about the years which are important. AIMS always play more importance to the first and the second year subjects rather than the final year subjects like medicine and surgery. Even the questions of the medicine and surgery that you get have got a lot of pre and paraclinical information linked to that. So as Dr. Praveen has rightly mentioned about the dissection videos, that is something that AIMS is notorious on asking. The derma images are directly images picked up from Dr. Nina Khanna's book. So I mean, those are some standard strategy. Another important point in a checklist is a very, very old saying. We used to tell it for all the previous year toppers, and all the toppers have also told us that this worked for all of them. Is AIMS is with the P. All the subjects that starts with P are important in the AIMS. Physiology, pediatrics, pediatric surgery, PSM, path, pharma. So any subject that starts with P is an important subject in the AIMS. But going by this, I mean, we do not have this much time. So what Dr. Praveen has told you are the checklist. In the checklist, don't miss out to the first point that was given in the checklist, and that was last 4 to 5 year of AIMS paper. The more number of papers or more thoroughly you can cover those papers, I am telling you, all is done. In fact, all the topics that we are mentioning are the part of those previous 4 to 5 year papers. I mean, just go with them and you are good. At this stage, I also want to tell you, please understand this. AIMS is just one exam. Please do not spoil your NEET PG preparation for the INI-CET exam. If somebody is scoring 70 correct, 80 correct at this stage, taking a very, very big jump to get a rank in the INI-CET, which can give you an actual branch, is slightly unlikely. But if you work hard for the 4.5 months, 5 months, you can get a very decent rank in the NEET exam. If somebody in a GT is scoring 500 plus marks, 550 marks, you are the ideal person who should work very, very thoroughly with a very, very sincere attempt for the INI-CET. If somebody is scoring 200 marks out of 800 at this stage, 250 marks or 300 marks or 350 marks at this particular stage, my honest advice as an elder or as a friend to you is, let's focus on the NEET exam. Let's identify that what are the subjects that I have not covered and I should work on them, and I should focus on all those aspects rather than just you doing a tick box that I have to write an AIMS exam and I have to prepare for the AIMS exam. Just keep on going with that. Dr. Sushil, what is your view on this?
Absolutely, boss. I agree with all your points. And to be very, very like, Dr. Praveen also said, I'll start with what Dr. Praveen said. See, AIMS in last couple of years, like you said, no, all the subjects with P are important. So orthopedics, the P here is also very important. I was just,
Unfortunately, radiology has no P in it.
So we'll take care of radiology partner in orthopedics, all the images. So what I would like to just say, guys, that what Dr. Rajat said and Dr. Praveen said, it is absolutely true. If I just tell you in very, very short, the last few years of questions, if you see the changes that have been made, like in 2020, if you all guys have seen the previous year papers, in 2020, the question asked was a very simple one regarding the external fixator. It was a simple image of LRS. That is what you call the rail fixator. It was a simple image and they asked what it is. In the next session, when the question was changed from the external fixator, they said that identify all of these appliances can be used to give the external fixator, which one cannot be given. So now they are asking you, testing your knowledge, that have you been ever to your wards? Have you ever seen that what exactly Ilizaro needs? What exactly the LRS needs? And this year, this latest session, they asked the question, they gave you the image. And in the image, the fixator was applied to the femur, to the tibia, and there was an interconnecting rod. And they simply asked you that why it has been given. So like Dr. Rajat very correctly said that if you have been to your wards, if you have been to your clinics, things are not that difficult. So apply some logics, try to just recapitulate what you have seen while you are going through your OPDs or the wards, or some patient if you have observed them while going out or in of the hospital. So these things actually matters a lot. Now, other thing is like the instrument, Dr. Praveen already very clearly mentioned, AIMS has never asked you atypical kind of questions. Never. No atypical kind of images, which you can, like if I say Hoffman kind of retractor and all, obviously it is not expected from you guys to know the names of so many hi-fi instruments. Not at all. But if you observe, very basic instrumentation has been asked, periosteum elevator, the bone holding forceps, the plate holding forceps. So stick to the basics. There is no need to get panic that it is AIMS, so it is going to go for another level. No, that doesn't happen. But yes, clinical, they matter. Other thing is 1 to 2 question, you can expect that they will be, out of the context that you have ever read. So from orthopedic part, I remember last year they asked about the patellar clung syndrome. Nobody would have ever heard of that before that, In UG, it is not expected because that's a complication of knee replacement we do. And that doesn't happen in all the patients. So it is not a routine topic to be taught. But yes, that was one question. So my suggestion here would be that there is no need to panic for those kind of 1 or 2 questions. Our fight is for rest of the questions. Okay, so that is the most important thing I would suggest. And yes, stick to the basics and the concept. The first and second year, like Dr. Rajat very, very, correctly said, first, second year have been given the importance. Reason being, if you see the last year question, the Trendelenburg test. Yes, we do in orthopedics, but how it was asked last year, they gave you a cadaveric section. And in the cadaveric section, they marked the nerve, that superior gluteal nerve was marked. And then they said the history, that patient was asked to stand on this side and other side of pelvis drop down. What was the most likely structure, which is marked here as well. So anatomy, yes, importance has been given, but obviously every clinical subject is coming from your first and second years only. So basic insight, basic knowledge has to be there. No need to panic and no need to run after the thousands of topics. It is always good to go with the basics and concepts. That I believe is the key to any of your exam, especially the AIM, because all the clinical things are coming from basics only, right? So that is my suggestion to you.
Yeah. See, guys, class notes or previous year MCQ is the single most important thing that is sufficient to get a 3-digit rank in any exam. I mean, I don't think that I need to emphasize on this. If you have very, very thorough with the class notes of all 19 subjects, and you have done previous year MCQ, you can get not 3-digit, you can also get 2-digit also. Single digit, yes, then that becomes a challenge. There are many more things that are needed to get a single digit. But for a 2-digit, 3-digit, a class notes plus a previous year MCQs are the primary key. As Divya has mentioned about the silly mistake, yes, that is something that takes you out of the race. Because if I'm going to look at it, majority of the time, what I call is every MCQ exam has a 20-30-30-20 rule. That means 20% of the paper will be very simple, 30% of the paper will be an average paper, 30% of the paper will be a rank deciding paper, and 20% of the paper will be undoable paper. So what matters is the entire that third game, that is a 30% of the paper. And that means it's a 60 questions, be it INI-CET or be it the NEET exam. How you perform in those 60 questions is going to decide your rank. Rank 1 gets 700 marks. Rank 35,000 gets 400 marks. There's a difference of only 300 marks, which is 60 questions. So how you have performed on those, how you are able to handle your nerves, how you are able to identify the correct answer in a distractor, that's a key. The easiest way to remove a silly mistake is first remove that fear of writing the test. We go to the classes. There are 700 students who are sitting in the class. You ask them how many have given the exam. There are hardly 100 students who have given the exam. Those 100 are definitely getting a rank. Those 600 who are not writing the exam, I don't know what will happen to them. They may or they may not. But the moment you write the exam, you see that this is the mistake that you're doing it. Your brain works on this, oh, I have to avoid this mistake in the future. The best way to avoid a silly mistake in the exam is to commit that mistake before the exam. That is my simple philosophy. Because if you have done the mistake once, that is acceptable. If you have repeated it again, that is not acceptable. So it is better to do it before the exam in one of the mock tests, so that you know this is the mistake that you do and you're not doing it again. But we have a fear. We feel that if we will write the exam, what will happen? People will think that I have got a bad marks. I will go into the guilt. Let it be. Let it be. Just go into your neutral. Let's face the mirror and then work on it. I mean, that's usually my suggestion. Over to you, Dr. Praveen, for the last few points about your take on this.
Thank you, sir. Maybe we can just understand few things apart from your checklist, that what you must be focusing on. Any exam is about working hard. So the first thing you must do is ensure that from today till the 12th of November, you try to put all the efforts going into every other directions and bring it back to studies. So that is number one. So work hard. Be disciplined. That means you put the number of hours you want to and ensure that you are able to finish those number of hours. Number of hours, are they important? I'll say they're must. So minimum number of hours that you must be able to commit from today to the exam point is at least 10 plus hours. Now, some students can give it 14 hours plus hours. That's very good. But if you can at least put in 10 hours of dedicated study from today till the 12th of November, at least you will not have that repent that I could have worked this point extra or that point extra, which would have given you 1 or 2 extra marks or correct there. The third thing I'll just like to put it here is your positive thoughts. Many times we have that, thought coming in mind that maybe we'll not get a rank, and that maybe puts a negative impression, and maybe that because of that maybe you're not putting in that extra effort that you could have just because that you're doubting your skills. So that positive thought is important. At the same time, if anyone is actually telling you कि नहीं यार INI-CET पे इस बार नहीं होने वाला because 1 महीना बाकी है, so just be distant from that person. I think he's not the right friend at this point of time. What you must tell yourself is, come se come, let me work hard for getting a rank. And people like us, all average students get a rank. हाँ, जो बहुत अच्छा इसने किया अपने medical college में, they have been toppers throughout their career in medical college, they will surely get the top 5, 8, 10 ranks. But ठीक है ना, हम लोग भी तो हैं, we will work hard for that. So make sure that you have that positive intent and stay away from anyone who is actually distracting you. Now putting in the last part of the smart study. Hard work important है, but smart study भी important है. So smart study के लिए ensure करो that you get into the previous year question, previous year topics. Don't miss on the first and second year important topics also. Don't miss on the practical aspects, the clinical aspects, the instrument aspects, and the clinical examinations also. And finally, what I'll say is कि last के I'll say last 12 days मतलब कि जब आपका 1st of November शुरू हो रहा है, from 1st to the 12th, put in the maximum revision mode. क्योंकि हमें क्या होता है कि हम पढ़ रहे हैं जो हम पीछे से पढ़ रहे होते हैं, what you read before that actually we forget a lot. So ensure that you have revision mode on and you try to revise all those volatile topics, the topics that you always wanted to, the question that you have bookmarked somewhere, the GT that you have given, and you have made your points in the 20th notebook that you have made throughout the year. Don't miss on those facts. Those are real saviors which you have done and worked throughout your last 3, 4, 5, 6 months of preparation, and that is what will give you a rank which is much better than your own expectations. So if you will put these few points in your mind, I think there's no stopping for you getting a very good rank in INI-CET. So
Yeah,
back to you, sir.
Yeah, I mean, absolutely correct. So just guys, stay focused. First, identify that is your preparation going as per your INI thought? Are you scoring more than, even if a safer margin that you're going to say, I will ask 500 out of 800. If you're scoring above than that, then think about the INI-CET, try to give your best attempt. Be thorough with the previous year topics. Be very thorough and start. Those who have finished the course, okay, this is another point that I want to say. There are some students who have finished the course once. Now it's an ideal time for them. Do a very thorough revision up to the AIMS exam. And from the 15th November, we're going to start the revision for the NEET exam, even if you're not in the best of your preparation. But if you're in the middle of your course, then don't change your strategy just for the INI-CET exam. It is only for those students who have either finished the course once, one, and the second, who have already scoring a decent score at this particular stage and want to give a best shot. Stay focused, stay positive. We have a lot of time, and I'm telling you that if you will remain focused, you can get a very good rank in the exam. That's all from my side. Dr. Sushil, if you have some closing
Yeah,
remarks,
just
please.
one point I would like to add. Many people have put a message about the vibe. So guys, I want to clarify this point. Vibe is not only about some 15, 20 or 30 images of a subject. It is a source of revision of the whole subject by the means of those important images, right? You all can understand. It is not about that 20 images are being shown and 20 images are being asked in the exam. It is about revising all the important topics which are important for any of your exam. And especially we have kept this program, like we do it once a year. So all, like I can tell you about my orthopedic part, Rajat sir's radio part, Praveen sir's patho part. It is always being taken care that the whole content, obviously it has to be like, you should also know what is the most important part, what is somewhat important part, what is not that important part. But yes, you should have the idea. You should be able to divide your content in that way. So why is the revision not for images, but for the whole subject, right? So that should be very clear in your mind. And other thing is this one you were saying. Yeah, that has been taken by Rajat sir already. Okay, so that is all I think. So guys, not to take much of your time, you should go back to your studies. So I would just say that stay calm, stay cool, stay focused, and that is all you need to just crack the exam. So maintain your calm and cool in the exam. Give it a try before you go to the real exam. Without practice match, nobody enters a World Cup. Nobody sends a team which has never prepared, in any of the state level exam, any of the state level match or Ranji match. So you're not never going to the World Cup without a preparation. So just try it. Wherever you're weak, accept it. We have a lot of time. You can improvise. Believe on that point also, right? So have trust in your preparation, and I think you're good to go. Over to you, Rajat.
Thank you, Dr. Sushil. Thank you, everyone. So do let us know if we can help you out in any form, in any way. We will try our level best to provide you the support and the comfort that we can. Okay, take care and all the best.
All the very best, everyone. Thank you so much.